Studies have shown that when you have better strength and better range of motion, the outcome of your knee replacement is much better. And that's why it's important for you to have good strength and some key muscles surrounding your knee and your hips, and also good range of motion so that you will have a successful outcome from your knee replacement. And also your recovery from the surgery is going to be much faster. Some key muscles there are your quads and your hamstrings, which are directly connected to your knee. Your quads will enable you to support your weight without your knee buckling. Especially important is when you're supporting your weight and your knee is bending. That will prevent your knee from giving out. And some key hip muscles that you want to strengthen there will be your gluteus maximus and your gluteus medius. The gluteus maximus will enable you to be able to go up and down, especially in activities like squatting or standing up from a seat or going down the steps. And then the gluteus medius will help you get rid of that lip a lot sooner. First exercise is called the leg extension. So this will help strengthen your quads. So you can sit on a normal chair, make sure it's not too soft, make sure that you have a firm surface, and put a towel under your thigh in this position here, just above the knee. And then what you want to do is have a weight. You can have adjustable ankle weights, put it above your ankle, and what you're going to do now is you're going to straighten your leg and then just bend it down. Straighten your leg and bend it down. Repeat that for 15 repetitions. You can do it for 3 sets. The next exercise is the hamstring curl or the leg curl. This will help strengthen your hamstrings. You can hold on to the back of a chair or kitchen counter or dining table. Still have the ankle weight above the ankle, and you're going to bring this back. Make sure your movement is bringing your ankle, bring your foot or your heel towards your butt, going this way. Make sure you avoid bringing your knee up in front of you like this, okay? Make sure that the heel tries to touch the butt as high as you can, with your knee or with your thigh pointing still straight down, vertical. Now the third exercise is called the straight leg raise. You can bend your hip and knee like this so that it will help support your back, and just keep your other leg straight and just relax your ankle. Doesn't have to be up, doesn't have to be down, just keep it relaxed. Make sure you lock your knee and bring your knee up. So bring your leg up like this. If you can hold it for 3 to 5 seconds will be better. If not, because of pain or for whatever reason, you can just hold it for a second and then down. So this will help strengthen your hip flexors, and it will help strengthen your quads as well. Repeat this for 15 repetitions. You can do 3 sets if you're holding it only for a second, but if you're holding it for 5 seconds, you can do it 1 set of 15 repetitions. Now this one is similar to your straight leg raise to the front. The difference is you're going to lift your leg up to the side. So bend your knee so you'll be more stable, you're not gonna turn. And then keep your knee locked, and foot will be just relaxed. It doesn't have to be up or down. It's not as crucial as long as your knee is locked, and you're going to lift your leg up this way. You go up to 45 degrees and then down. Again, up and then down. Ideally, you want to hold it for 5 seconds, but if you cannot because of pain or because it's too weak, hold it for a second at least. So try to get to that. You can, if you're doing it, holding it for 5 seconds, you can do it 15 repetitions. If you're holding it only for a second or so, you can do it 15 reps, but then you can do it 3 sets. Now the fifth exercise is called bridging. This will help strengthen your gluteus maximus. So from this position, you're going to just squeeze your butt cheeks together and then lift your hips up and then down. So squeeze your butt cheeks, lift your hips up, hold it for 5 seconds if you can, and then down. Your goal is to be able to go as straight as you can. That's why it's called a bridge. Okay. If you can hold it for 5 seconds, you can do it 15 repetitions. If you cannot, it's because of pain or because of weakness, you can do it 15 repetitions, but then do it 3 sets. So this is actually similar to doing a squats. I prefer to do this before the surgeries because most of the time, the reason why you're gonna have surgery is because you have pain on your knees. And doing squats can aggravate that, or sometimes you'll not be able to do the squats because of that pain. And doing this it's a lot more comfortable in your knees, and it's a lot more doable for most of my patients. Now, those are the top 5 exercises that I give to my patients to prepare for their knee replacements. I'd love to know what you think. Are those exercises that you can do before your knee replacement? Or are they too hard? Or are they too easy? I would love to know in the comments below. Thank you very much for your time. Thank you very much for watching this video. I hope these videos are helpful to you, especially these exercises, when you're going to prepare for your knee replacement, or even if it's a different kind of knee surgery, as long as there's no contraindications to any of these movements. And please share this with someone you love so that you can help them prepare for knee replacement if they are in that situation. Now, don't forget to hit that subscribe button and turn on your notification, because we release new videos every week, and I would want you to be alerted when those new videos roll out. Again, thank you very much for your time and appreciate you.